Do you know that the number one cause of death in Singapore is cancer? And do you know that the number 3 cause of death in Singapore is ischemic heart disease, commonly known as heart attack? Are you aware that there are screening tests available for these conditions? Hi, my name is Dr. Chen Yiming, and we will be talking about health screening today. Who should get their tests done? At what age should the testings be done? And what screening tests are important? All this and more. Please watch till the end of the video to know what tests are important for you. Please click on the subscribe and notification button as well to receive updates whenever we produce a new video. Health screening is a battery of physical examinations and tests that are done for an apparently well individual, with the aim of detecting early illnesses that can be treated early, reducing its complications, the sufferings, and even death. These illnesses that are early are often asymptomatic. The patients often do not have symptoms. That's the scary part of it. What constitutes a health screening? It includes a physical examination by the medical practitioner, tests such as blood test, urine test, stool test, pap smears, imagings such as ultrasounds and mammograms. Obesity is an important diagnosis which can be detected through health screening. It first involves the measurement of your height and your weight, followed by the calculation of a BMI using the formula. You use your weight in kg, divide by your height in meters, multiply by your height in meters. The number that you get is the BMI. If your BMI is less than 18.5, you are underweight. If your BMI is 18.5 to 25, you are actually healthy. And if your BMI is between 25 to 30, you are overweight, and anything more than 30 is obese. Being overweight and obese is unhealthy, and it predisposes you to other chronic medical conditions like hypertension, cholesterol, and diabetes. Hypertension has no symptoms. It is diagnosed through the measurement of your blood pressure, and if your blood pressure is more than 140 over 90 mm mercury over 2 to 3 separate occasions, then you are deemed to have hypertension. Hypertension has no symptoms, and if you're above the age of 40, you should get your blood pressure checked at least once to twice a year. In our fast-paced, stressful lifestyle, in fact, most of the time, as long as my patient is above the age of 30, I do a routine check of their blood pressure. Hyperlipidemia or high cholesterol can be diagnosed through a fasting cholesterol levels. It will yield a breakdown of your total cholesterol, your LDL, HDL, triglyceride levels. And if you have found to have high LDL and low HDL, you are at risk of atherosclerosis, which is the hardening and the blockage of your arteries, which will predispose you to serious complications such as heart attack and stroke. Cholesterol should be screened every year above the age of 40. You can also be screened earlier if you have a family history of high cholesterol, if you have pre-existing medical conditions like hypertension, diabetes, or if you are a smoker and you drink alcohol regularly and in large amount. Diabetes can be diagnosed through a fasting venous glucose level. If the venous glucose levels is less than 6, it is normal. Between 6 to 7 is impaired fasting glucose, and more than 7 is diabetic. You should get an annual fasting venous glucose done if you're above the age of 40. You can consider getting it done earlier if you have family history of diabetes, you have diabetes during pregnancy, if you have pre-existing medical conditions like obesity, hypertension, high cholesterol, you can do it earlier. Colorectal cancer screening should be done for all individuals above the age of 50. Colorectal cancer can be asymptomatic in its early stages. Screening can easily be done by obtaining a stool sample and sending it to the lab to detect microscopic levels of blood. And if found to be positive, further testings will be necessary to exclude colorectal cancer. Breast cancer is the most common cancer in females. Screening involves doing a mammogram or ultrasound or both. It is recommended that if you are between the age of 40 to 49, you should get an annual screening test done. If you are between 50 to 69, you should get a screening test done once every 2 to 3 years. Your doctor may recommend that a screening test be done even before 40 years of age if you have a strong family history of breast cancer. Cervical cancer screening can be done through a pap smear. It is indicated between the age of 25 to 69. Pap smear should be done once every 2 to 3 years if it's normal. Recently, there is a HPV DNA screening test that can be done once every 5 years. So, very quickly, we have already discussed the various conditions that can be diagnosed through a health screening. In summary, if you are above the age of 40, you should get your blood pressure checked, your fasting venous glucose checked, and your fasting cholesterol checked. Additionally, if you're above 50, you should have your stool screened for the presence of blood to detect any possible colorectal cancer. If you're a female above the age of 25, please remember to get your pap smear done. And if you are female above the age of 40, you should also get your mammogram and/or ultrasound breast done as well. Let me stress that a health screening is a very personalized process. There is no one-size-fits-all panel, and a detailed discussion with your family doctor is highly recommended before you actually embark on the test. Thank you for watching the video. I hope that it was informative enough and it would encourage you to go for your annual health screening. If you like this video and you would not want to miss any further contents that we will be producing, please click on the subscribe button. Till the next time, stay safe, stay healthy. See you soon.